Today, we're going to talk about depression. And depression is more than just a fleeting sadness. It's a deep, pervasive mental state that affects not only the content of our thoughts and emotions, but also directly affects our body's physiology. But as a consequence of this, it provides a doorway to understanding the human condition, offering insights into the interplay between biology, psychology, and philosophy. In today's exploration of depression, I'm going to navigate the topic from the perspective of all three. To briefly define what I'm referring to when I speak of depression, the diagnostic manual referred to in clinical settings provides some clarity. Depression in of itself is a broad term which describes a mental state. There are various categories of depression that are quite well established though, and as it's categorized in the DSM-5, this diagnostic manual I was referring to, these categories are mood dysregulation disorders, major depressive disorder, persistent depressive disorder, premenstrual dysphoric disorder, seasonal affective disorder, substance or medication-induced depressive disorder, and other specified or otherwise unspecified depressive disorders. And there's also depression that's associated with bipolar affective disorder. But first, I'm going to explain how depression is seen from the perspective of the most prominent schools of psychology and psychotherapy. By explaining how depression is viewed from each school, we can lead on to the justification of how they then go on to treating it. I'll also try to do the difficult task of introducing the philosophical schools I believe each of them have been most influenced by. Now, the reason I think it's so important to do this, especially with the newer forms of psychotherapies, is they sometimes fall short in their ability to transcend academic boundaries. They can therefore appear formulaic without a deeper perspective on their delivery. Merging philosophy with psychotherapy addresses this limitation, as philosophy, much like art in a way, by making some necessary assumptions, has a way of touching the very essence of an individual. By talking through all the most influential perspectives the different schools of philosophy and psychology have on causes and cures for depression, it will give you a complete understanding, as they rarely contradict each other, and if you're a therapist, they can often be integrated, or if you are an individual who has depression or is just purely interested in the subject matter, you'll have a clarity on the landscape, enabling you to better decide the approaches that interest or even appeal to you. So first off, I'm going to touch on what is often coined as depth psychology, and in this I'm going to expand on psychodynamic therapies and analytical psychology. Psychodynamic and analytical models bring into focus the unconscious undercurrents that shape our emotional lives, and hence the term depth. The answers here are seen as within. Specifically in the realm of analytical psychology, the founder of this school, Carl Jung, posited that depression often stems from a lack of unity between the conscious and unconscious processes, rather than merely being a signal from the unconscious. This disunity, he posited, leads to unresolved conflicts that Jung believed could be addressed through an exploration of the unconscious, utilizing methods like dream interpretation, engaging with archetypes. Now, in relation to the philosophical schools that are quite closely paralleled, Jung was definitely heavily influenced by the Gnostics and the Taoists. Now, within Taoism, the emphasis on balance and unity, which is referred to simply as the Tao, closely resembles this kind of unity that Jung spoke about between the unconscious and conscious processes. Now, as well as this, a theme that runs through analytical psychology is this interplay between opposites, and the Taoist concept of yin and yang represents this dynamic interplay of opposites, and this closely mirrors Jung's idea of the anima and the animus, the feminine and masculine aspects within each individual, and his broader theme of integrating opposites within the self to reach this psychological wholeness that he commonly referred to as the individuation process. Next, there's the behavioural therapy. So the behavioural model reminds us of the role of action and reinforcement in our mood states. This perspective suggests that depression can be maintained by a cycle of inactivity and avoidance, which in turn prevents positive reinforcement from natural sources of pleasure and accomplishment. By altering our behaviours, engaging in activities that provide direct or indirect rewards, we can disrupt this cycle. So behaviourists approach depression from the perspective of learned behaviours and maladaptive responses to the environment. They utilise techniques like behavioural activation and exposure therapy to encourage patients to engage in activities that are likely to be rewarding, and thereby disrupting the cycle of avoidance that perpetuates depression. Now, this method, in my view, resonates quite a lot with the Stoic emphasis on focusing on what is within our control, advocating for a pragmatic approach to change through action. They taught that our reactions to external events, more than the events themselves, determine our well-being. Next, we'll move on to cognitive therapy, and the cognitive model really underscores the power of thought patterns in shaping our emotional world. Cognitive therapy, particularly focused on the treatment of depression, scrutinizes the role of cognitive distortions and biases. These are systemic ways of thinking that are not based on reality. Examples include all or nothing thinking, where individuals see situations in black or white terms, overgeneralization, where a single negative event is seen as a never-ending pattern of defeat. By identifying and challenging these distortions, cognitive therapy works to replace them with more accurate and beneficial thoughts. Again, turning to ancient Greece, this approach largely echoes the Socratic method, in which the questioner systematically questions the assumptions and beliefs of the individual they are questioning. And this encourages a philosophical dialogue with the individual to uncover and challenge the veracity of negative thoughts in the case of depression. Next off, there's what can also be coined as height psychology. I'm going to merge, but also describe them individually, the existential therapies, the main one being logotherapy, and humanistic therapies. First off, the humanist approach to depression. This is deeply rooted in the concept of self-actualization, which refers to the realization and attainment of an individual's potential. Humanists often posit that when individuals are unable to fulfill their potential and live in accordance with their values, for instance, as a result of societal pressures, unfulfilling relationships or work environments, the stifling of creativity and personal expression is instrumental in the cause of depression. This lack of authenticity, humanists would argue, can often lead to depression. Not only does this provoke ongoing internal conflicts within the individual, because they are forever aware at some level they're living a lie, but I think we can all understand that it'd be a reasonable assumption that living a life of perceived monotony, whereby the majority of your time is taken up by experiences you don't perceive to be of value, well, for an extended period of time, it's likely this is going to have a detrimental effect on your well-being. In the case of depression, this is very similar to Viktor Frankl's logotherapy, which would focus on the existential vacuum that arises when an individual's life lacks purpose or meaning, or when there's a stark misalignment between one's values and their current situation. I would argue that the Existentialists take it one step further, in that, well, they address both this alongside the individual's attitude to the circumstance, which is also largely perpetuating the depressed state. And this is important. I think that in the current state of society, and the amount of bureaucracy that floods into a lot of what we do, whether it's our jobs, daily transactions, whatever it may be, as well as the fact that many of us may have responsibilities, people relying on us, say for instance income from a job that doesn't fulfill us. So in most circumstances, our choices affect those around us. And so this kind of radical reorientation towards a path of authenticity, when identified, is realistically not going to be straight away. It will be done incrementally over a period of time. So importantly, the attitude taken to an individual's current circumstance that may be largely out of their control, and the framing needed in order to extract meaning regardless of their external environment, alongside the practical implication of aligning oneself with their individual purpose. Well, I'd argue that the existentialists do this better than anyone. But regardless of both of these important schools of thought, logotherapy and humanistic therapies, well, their methods both lie in specific ways designed to help individuals discover their unique purpose and meaning in life, and then ensuring they pursue this, allowing for this necessary realignment. Now, this is obviously closely paralleled and influenced by existentialist philosophy, particularly the works of philosophers who grapple with the concepts of freedom, choice, and the inherent search for meaning in the human condition. Take Nietzsche. He viewed suffering, including the depths of depression, as integral to personal growth. Kierkegaard, often considered the father of existentialism, delved into the nature of despair, which he saw as the sickness unto death. Now, for Kierkegaard, despair arises from not fully becoming oneself, from an imbalance within the self that is aware of its potential but unable to actualize it. And lastly, there's Albert Camus, who is famous for confronting the quote-unquote absurdity of life. And he argued that the recognition of life's inherent meaninglessness should not lead to despair, but rather to a rebellion through embracing life passionately. It's almost emphasizing courage, turning into pain with a smile on your face. So as it relates to psychiatry, looking strictly through the lens of the medical model, depression is seen to be a consequence of, I'll list the following mechanisms. At first, we have the monoamine hypothesis, which is largely responsible for the antidepressants currently available. The monoamine neurotransmitters are serotonin, norepinephrine, and dopamine. And the current antidepressants being that of selective serotonin reuptake inhibitors, so SSRIs, SNRIs, so selective norepinephrine reuptake inhibitors, NDRIs, so norepinephrine dopamine reuptake inhibitors, and then we have the kind of atypical antidepressants, which are complex in the way they work. Now, depending on which class, they will alter the levels of one or more of these neurotransmitters. Now, they do work, and I would argue, if more appropriately prescribed, tailoring the type of antidepressant to the subtype of depression, they would work better, but they're far from a cure. And so the more promising treatments that are emerging are largely based on differing theories. These would include the effect that specific hormones have, and not surprisingly, other neurotransmitters, namely glutamate. Both of these are shown to play a role. It's also becoming evident the role that inflammation has in depressed states. This is thought to be why the omega-3 fatty acids, specifically EPA, and NAC, which is just an abbreviation for N-acetylcysteine, have both been proven beneficial in improving mood states. It's thought to be due to their effect on inflammatory states. Now, most interestingly, the slightly more well-known avenue of research into a possible cure or ailment for depression is by inducing plasticity in the neuronal networks. Now, ketamine has been trialled and used for this, but the effects are short-term. Psilocybin, however, in the few trials done, shows some really impressive results. With psilocybin, it works in depression via its role in altering the connectivity of regions of the brain known to be affected in depression. These are the DMN, the default mode network, the SN, the salience network, and the EN, the executive network. Now, the abnormalities seen in these regions are thought to be responsible for the cognitive aspect of depression, being a state of persistent negative rumination, rigidity in thought pattern, and reduced ability to divert attention away from the negative rumination that's so common. So psilocybin works primarily to alter the connectivity of these particular brain regions that, again, are largely thought to be responsible for the cognitive aspects of depression. So that's a comprehensive overview of depression from the fields that I guess have most to say about it. By speaking about it from these perspectives, I guess I don't want to detract from really the fundamental factors we all need to ensure a maintenance of generally good health. These are mainly exercise, a job, relationships, the sleep-wake cycle, nutrition, and lastly, the deliberate practice of remaining present in our day-to-day experiences. I hope this overview has done what I intended it to do, which is tie together insights from differing fields in a way that complements a broader understanding of each topic. Anyway, if today's conversation has resonated with you, obviously please share it to others who might find it meaningful. And please also subscribe for more discussions that mirror this episode. And of course, please feel free to contact if you have any questions about the content covered. Thanks for listening.